It is April 5th, the beginning of National Public Health Week, and welcome to CSGV at Home. My name is Andrew Patrick, and I'm the Director of Political Communications at the Coalition to Stop Gun Violence and our sister organization, the Educational Fund to Stop Gun Violence. Today, we are speaking with Mighty Fine, Director of the Center for Public Health and Practice at the American Public Health Association, and Lisa Geller, our CSGV and Ed Fund State Affairs Manager. Welcome to both of you.
Thank you.
Happy to be here.
So, Mighty, today is the start of National Public Health Week. This is a week the first week of April every year that APHA has championed and made this huge event. What is public health, and why is gun violence a public health crisis?
Yeah, so public health to me, as a public health advocate, I'm like, public health is everything, right? But, but drilling it down a little bit more, you can think of it as the science of protecting and improving the health of people and communities. I'm a trained social epidemiologist, so I think about it from that lens as well, right? So we're looking at the distribution and determinants of disease upon a population, but also taking into account the social and cultural and other contextual issues that influence our health and well-being. And so we look at diseases, we study diseases to understand why they're happening, including gun violence, and really working to prevent them from occurring in the first place across different levels of prevention. But public health and the work that I do really focuses on what we call upstream approaches, right? So really looking at the root causes and what are the factors that exacerbate the likelihood of adverse health outcomes like gun violence or firearm injury, right? Whether we're talking about death or injury there. And we know that gun violence is a leading cause of premature death. We also know that it's very preventable, and with public health measures through our tireless efforts of studying the issue and understanding it, but also using our lived experience to understand how to counter it. And I think what in public health we also bring to the table is that we want to ensure that the environment is not conspiring against the changes that we want to see, but it's in alignment with that. So we're moving in one direction where people can live healthy, happy lives that are free of violence.
Yeah, and at CSGV, we have made this concerted effort to kind of look at gun violence through a public health lens, address this as the public health crisis that you just spoke about. So Lisa, the majority of the public sees gun violence just as these high-profile mass shootings. It's what gets attention. It's shocking. Those are actually a minority of American gun deaths. So what is the public missing when the gun violence debate is framed around mass shootings, and what other types of gun violence are we just not talking about generally?
That's a great question. So as you mentioned, these mass shootings are a small percentage of overall gun deaths in this country. It's estimated about 1%, although the definition of a mass shooting will indicate what percent of mass shooting or of firearm deaths it represents. But about 1% is usually an accurate percentage. This is missing, of course, 99% of gun deaths, which the vast majority of gun deaths in this country are suicides. 60% of gun deaths are suicides, and half of all suicides are by firearm. And about 36% of gun deaths are homicides. And the vast majority, 75% of all homicides, are by firearm. Within homicides, there are domestic violence homicides, police-involved shootings, and community gun violence, as well as other forms. And then another smaller percent of gun deaths in this country are unintentional shootings. So by just focusing on mass shootings, which are highly unpredictable, sometimes highly rare events, we are really missing this larger conversation about how to prevent firearm suicides and other firearm homicides.
Thank you. So Mighty, the social determinants of public health, can you explain what they are and how they relate to gun violence?
Sure, it's sort of what I alluded to before when I talked about risk factors, right? So social determinants of health are really those social factors that influence our health, our well-being, and our quality of life, really. So thinking about having access to safe, and stable housing, transportation, safe neighborhoods. But even within that definition of safety, acknowledging that we need to ensure that we have a shared safety perspective, right? Because what's safe for me may not be safe for someone else. So we have to uplift what that shared safety experience should look like. We also know that it overlays with racism and discrimination, education, job opportunities, income, so violence, even to me in the work that we do, we look at violence also as a social determinant of health, because we know that the presence of violence exacerbates the likelihood of more violence happening. And so when we think about those social determinants, individually, they're challenging, right? But when we think about violence, and we know that sometimes it's concentrated, it's because we have these pockets of concentrated disadvantage where all the social determinants are at play. And so what we in public health need to strive to do more of is not just the absence of violence, right? But it's the presence of opportunities and other measures that we know are going to counter these adverse impacts on someone's health. So again, just in summation, it's the social factors that impact our health and well-being.
And the theme this year is building bridges to create better health. And as you look at all the different types of public health, like the public health in a global pandemic can affect the epidemic of gun violence because of the factors that are in play there, and addressing the root causes of public health in communities that have high levels of gun violence could lead to a decrease of gun violence in those levels if you look at the structural root causes there. So it's really important, and a really important discussion and good theme this year. Lisa, like we've been saying, gun violence is a public health crisis, but like most public health crises, it's not distributed evenly across the public. What are some of the groups that are disproportionately affected and impacted by gun violence, and why is that?
When we think about these disproportionate impacts, I like to think of it in a few ways. One is by sex, one is by age, and finally by race and ethnicity. And so when we look at the age distribution, we know that 86% roughly of all gun death victims are males. So males are definitely the disproportionately affected by gun violence. For homicides, it's about 84% males, and for suicides, about 87%. Next, we look at age distribution. We know that those on the younger end of the age distribution, about 15 to 35, are disproportionately impacted, and also those males 75 and older. The younger of this group is disproportionately impacted by homicide, and I'll speak specifically to young Black males being disproportionately impacted. And on the older age, about 75 plus, those are males that are disproportionately impacted by firearm suicide. And then finally, as I mentioned, race and ethnicity. For males, Black males are nearly 2 times higher group impacted by gun violence than the second highest group, which is American Indians and Alaska Natives. For females, that group, the American Indian and Alaska Natives females, are disproportionately impacted by gun violence, followed by Black females. So gun violence does not affect everyone equally. And it's really important that we note who is at a higher risk of gun violence.
Yeah, absolutely. So I want to thank you guys both so much for making the time to come on. Lisa, I know that CSGV has our annual National Public Health Twitter chat, I believe tomorrow on Tuesday. Can you tell us the details, hashtags, time, so people can get involved in that?
Absolutely. So as you mentioned, our Twitter chat is tomorrow, Tuesday, April 6th. And it's going to be 11 a.m. Eastern, and we'll be partnering with Mighty and everyone at APHA for this. And the hashtag is going to be PH, as in public health, for GVP. But you can find all the information for this on our Twitter, on APHA's Twitter, and just check there for more information.
Thank you so much, guys. Let's make it a good National Public Health Week. This is part of the discussion. It's very important. Public health is important. We've learned that so much over the last year, and we got to keep banging that drum. So thank you so much, and have a wonderful day.
Awesome. You do the same.